Hello, everyone. You're Stéphane Labelle with Fenestration Canada. I'm your Executive Director, and you're listening to Ask the Expert, Getting Ahead of the Curve, the proactive planning of the long road to recovery with Suzanne Bernier. This session is presented by Everlast Group of Companies. I would like to take this moment to thank them for their support. And now I would like to introduce to you our presenter for today, Suzanne Bernier. So Suzanne, why don't you go ahead and tell us a little bit more about yourself?
Sure. Thanks, Stéphane. Thanks for having me. And hello, everybody who's joining in today. Thank you for taking the time. A little bit about my background. I've been in pandemic planning for 18 years now, ever since we first faced SARS. Some of you might be familiar with and heard of SARS, the severe acute respiratory syndrome, which was also a coronavirus that was pretty serious in the Greater Toronto area. Not so serious in a lot of other areas, some localized epidemics around the world. That was in 2003, you might remember. After that, and we got through that, we had 44 deaths in the city of Toronto, by the way, in a very tight, condensed period of time during that SARS epidemic. And just so you all know, SARS actually wasn't deemed a pandemic. It was a localized epidemic in certain areas of the world, including the Toronto area and the GTA. But after that, I went to work with the Workplace Safety and Insurance Board and was asked to produce Ontario's first pandemic plan in response to lessons learned from SARS and some of the failures that happened there, to ensure that if something larger happened on a pandemic scale, that businesses and governments would be able to respond effectively and have plans in place ahead of time to think about what could happen and what they'd have to put in place ahead. So I did that. I created what ended up being Ontario's first recognized pandemic plan. I then spoke about it at a United Nations meeting in Switzerland, and then ended up being invited to work at the United Nations headquarters for a few months to help test and evaluate their pandemic plans that they had created to be able to ensure that they could respond should a pandemic hit New York City and the world. And that's exactly the plans that they've had to pull out now over the past few weeks since this new coronavirus has come into play. So that's my background in pandemic planning, a lot of research, but a lot of lessons learned. I was also involved in our internal response to the H1N1 pandemic. I was at the Workplace Safety Insurance Board at the time. We had some internal cases. Now, if you remember, H1N1 in 2009 was a pandemic. However, it was an influenza pandemic. The influenza, H1N1, was not as virulent as what we're seeing this coronavirus is. It was not as deadly. It was a pretty mild pandemic, if you define pandemics. And because of it, I think what happened, even though people had a heightened sense of awareness right up until then, because people were planning for bird flu at the time, because they were hearing about that around 2005. So people were really good at having plans in place and being aware of what might happen. However, then H1N1 happened, and I think a lot of businesses said, oh, well, that was the pandemic, then okay, well, we got through that okay, and kind of ditched their plans or didn't really start thinking about it again until, unfortunately, we saw this new virus come into play. And so now I can tell you there are a lot of plans that have been developed and guidelines that were developed in the past based on previous historic experiences that we've had with epidemics and pandemics. But this is completely a new game for a lot of people who didn't really plan for this magnitude and for it to spread so wide and so quickly. And we not really being able to know from one day to the next how it's going to react within our communities. So that's the challenge that everybody's facing. I wanted to also mention that I do sit on the Centers for Disease Control, and I'm sure if nobody knew who Centers of Disease Control were before, or the World Health Organization before, everybody knows who they are now. And I think, as I read this morning, they have the most traffic out of any government website right now. They have the most clicks on the Centers for Disease Control, but they have a weekly or a bi-weekly information call for the private sector. And so I sat in on that day before yesterday, and there was some really good information that I want to share with your membership, because I think it's going to be useful to all of you to know what's going on from a valid source, the Centers for Disease Control themselves. So I'm just going to read out some of the key points that were mentioned in that call that I'd like to share with you all. First of all, as I mentioned, this is a novel coronavirus. When you hear the word novel, it just means that it's new, and that means that it's never been seen before in the world. No one has immunity to it because no one's caught this before. No human has had this before in the world. That's why you keep hearing it being called the novel coronavirus. And because of that, we don't really know how it's going to act and react because it's new. And we don't have something to base it on from before. We didn't even know it existed 3 months ago. That's how quickly this has happened. We did see a quick rise, though, with SARS as well. From the time that we had first heard that there was a case, and then by the time it came into Toronto and patient zero landed, basically, and deaths started happening, it was in a fairly tight time frame as well. This is just, I'd say, magnified so much more because it's so much more infectious, and I'd say non-controllable right now in some areas of the world, including North America. And we'll see that rising depending on where you are, not everywhere geographically, but depending on where you are over the next few weeks and months. The majority of cases themselves are still in Europe, but US has the most lab confirmed cases. That changes, of course, the numbers keep rising. But at that phone call, we were at 150,000 cases in the US, but I know that's already jumped since that call. And over 2,500 deaths, which of course climbs every day as well. The hot spots right now, you're seeing obviously New York City and New Orleans, but also starting to see hot spots in Detroit and Boston. And we will see more. There's reasons why, of course, mass gatherings and a mass amount of people in New York City, New Orleans, that kind of thing. So there's maybe reasons for additional spread in those areas, but know that we're going to see other pockets that are going to have these hot spots as well over the coming weeks. And it may look different in your area, and it always will. So what I would say is take a look at what's happening locally and to get source information from your public health authorities at the local level first. You're going to be hearing a lot about what's happening provincial-wise as well, and there'll be orders coming out from your different provinces if and when it makes sense and it gets to that point for certain areas, or there may be local orders that happen. So it's really important for you to take a look at and keep in mind what's happening locally as opposed to just looking at what's happening on CNN or federally, because it's going to be very different depending on where you are. It's already very different where I'm sitting in Toronto right now than it is where Stéphane's sitting right now. So that's just an example. Okay, the higher risk is still in that, and you're seeing that probably in the news, around the 70 to 80-year-old age range are the highest at risk for potentially passing away from this virus. And those with underlying health issues, specifically heart, lung, kidney diseases, or diabetes. We are also seeing a lot of asymptomatic people. So that means people who are walking around that have no signs that they have coronavirus at all and may feel fine, or they just feel a little bit different, or it's a cold or something, but they don't really show any signs. And some of them just recover without even knowing that they had it. And many asymptomatic people are found to be in the age range of 30 to 40. Interesting to note. And again, that's a challenge because we like to think that, okay, we're going to tell people don't go to work if you feel sick. Or if you see somebody else who's sick, then make sure that they go home and self-isolate. But there's a lot of people out there that you can't tell and they can't tell. And they wouldn't even know that they have coronavirus because it's so mild on them. So that's the challenge, and that's why we're seeing more spread, and that's why you're going to see more orders and why they're happening in different areas to try to avoid that invisible threat, really. It is invisible to a lot of people. You're not going to be able to, you can't pinpoint, oh, that person has coronavirus because they're coughing. That person has coronavirus because they're sweating. Yes, it happens to a lot of people, but not to all of us. We're trying to flatten the curve. You're hearing a lot about that term. And what that really just means is We know that the virus is going to be out there. Probably it's not an influenza virus. It's not going to die off at the end of winter, and it's not affected by seasons. So that's the one thing. But what we're trying to do is flatten the curve. So if everybody is still out and about and doing their own thing, and a lot of people are spreading it that don't even know they're spreading it, and we don't control that right now while it's starting to become at its height, then yeah, we're going to see a sharp increase. And then none of our hospitals or our healthcare systems can handle a huge increase like we're seeing right now is happening in New York and New Orleans. They don't have enough beds now to be able to handle that huge influx. So we're trying to flatten that influx and spread it out more so that for the next few weeks, and depending on where you are, that'll change, trying to limit close contact and maintaining that social distancing, as well as the enhanced cleaning procedures, and coming up with creative ways to be able to still do the things that we have to do and provide the critical services that we need to provide, but without trying to infect others unknowingly. And then just have this big surge. Our hospitals can't handle it, and that's a whole other problem. So when you try to space people out, implement these measures over the next several weeks, then hopefully you're seeing the curve drop and spread out more evenly. And then we can deal with those surges or smaller surges in our medical care system, as opposed to one huge surge. So that's really what the bottom line is whenever you hear people talking about flattening the curve. It's not that we're flattening the curve and it's going to be done in June either. It's just that we know that it's going to be out there for a while. We're not going to get a vaccine, and this is straight from the Centers for Disease Control confirming we are not going to see a vaccine being distributed for 12 to 18 months. So I'd say look at least a year and a half from now before we actually have a vaccine, and it'll be eradicated. So it will be gone. Once we have a vaccine and everybody's vaccinated, and in the meantime, there are scientists and doctors and medical professionals are looking at other things that could potentially help. In the meantime, realistically, we'd have to wait till that vaccine is here to be able to clearly be able to eradicate the virus completely. All right. The hotspot of concern, of course, in a lot of our communities, and you'll see them maybe in yours, and you're already seeing them, as our long-term care facilities, because that's where a lot of our vulnerable populations are homed. We've got over 400 long-term care facilities in the US alone, and I'm sure it's more than that since Monday, since our call. And of course, we're seeing some increase in that in Ontario, unfortunately. Bob Cajun had a big deadly outbreak there. Plan for a second and possibly third wave, and I've been talking about this for a long time. This is going to happen, but it's not to scare people, it's just to make people aware of when we do get to that point several weeks or months down the line, depending on what community we're in, and people start opening back up and kind of getting back to business and the new normal. People are going to start forgetting about the social distancing perhaps and reinforcing that so much more. And we're going to see a second wave. Like in China, they're, I believe, already seeing a second wave. In every pandemic in history, there's a second and potentially third wave before a vaccine comes. So we have to really think about that too. And it's not going to be as harsh, but it'll happen. And so we have to think about how we progressively and responsibly stage back to business, keeping that in mind. So it's not going to be a point where we're thinking, okay, in June or whenever it is, that things are opening back up in your area and the orders are being released and people are starting to get back to normal. We can't stop there and think, okay, everything's fine now. We still have to remember that we've got a while to get through until the vaccine is out there. So let's still implement those measures that we've been implementing in a smart way that makes sense for our communities to be able to still function and do what we need to do, but in a safe way, keeping all of those things in mind, knowing that there's going to be a second and a potentially third wave. The best way to prevent the spread, of course, as everybody's been hearing, I think everybody's watched a video now on how to wash your hands properly. That still is the best way, as opposed to thinking that hand sanitizer is just as good as. Still the most effective way to kill off this virus, and any infectious disease virus actually, is by hand washing with just soap and water. What I would encourage everybody, if in your businesses, and I've seen this, and this just discourages people from washing appropriately and taking the time to do the 20 seconds, is if you only offer cold water. And I've seen that in some places that, and specifically public areas like malls, where you'll see people just go in and they dip their hand in for a second and they think that's washing my hands and this is too cold to be washing my hands for 20 seconds. Everybody, I think every business is going to have to be rethinking that, making sure that they're not discouraging their employees and their customers and clients from doing that appropriately. Another thing that's important to know, this is from the Centers for Disease Control as well, is the maximal survival times. So the coronavirus does live for several days on hard surfaces. It also now is found to live up to 24 hours on cardboard and paper products. So that's really something to think about and consider as well, is how much you're handling. And if you do have to handle, and there's a lot of people that are exchanging hard surfaces or working off of hard surfaces, shared surfaces, you have to bump up your enhanced cleaning procedures. Pretty much any time there's a potential for it to be handed off to somebody else, or even doorknobs. A lot of businesses now are implementing enhanced cleaning procedures where every hour they're cleaning off the doorknobs. Just think about all of these potential hard surface spreads and the sharing of equipment that might then make that worse for people. However, the positive side is what they're finding is it's mostly respiratory droplets where people are transmitting and getting the virus, which that means that's the highest rate of transmission so far, which that means if someone's coughing on you or near you and the droplets are lingering in the air, and then you happen to get a droplet, you touch your face, it gets in your system. And that's how quickly the coronavirus can get into your system, and it's that way. And so, of course, the best way to limit that is to limit your direct contact with anybody who may not even think they have coronavirus, but they happen to cough. Here's another thing that I would suggest highly is, for now, you get rid of this handshake. We're all so used to that, right? Is that's the formal greeting that we give people, and people expect that. But right now, in the height of the coronavirus life, I would say that do away with that and try to mentally come up with something else that you can do, like a peace sign, that's what I do, or something else to be able to acknowledge someone without touching them. Because think about if all someone has to do, cough into their own hand, they may not even know they have coronavirus. I had an Uber driver who was coughing and said, oh no, it's because I had ice cream and I cough every time I have ice cream. Anyway, but so if you're coughing to your hand and then maybe they don't know, you don't know, they go to shake your hand, they haven't cleaned their hand first. And then all of a sudden you've shook their hand, you haven't had the chance to wash your hand first, you've touched your face inadvertently, and then you might have been infected with coronavirus. All right, it's like I said, it's a new virus. There's lots of unknowns so far. You're going to see different statements and different things coming out every day based on what they're finding every day. And that's going to be ongoing for the next several weeks. What I can tell you is go to the trusted sources. So the Centers for Disease Control, the World Health Organization, your local public health authorities all have websites that they're now keeping up to date and have a lot of great information and resources for you to be able to access, as well as your provincial level and the federal level. There are so many good resources out there for you to look at. So make sure that you go to those resources as opposed to Googling or reading the news even, and go to those trusted sources for what's happening locally. Now you're going to hear a lot, probably over the next few days, about masks. And that's something that came up in the Centers for Disease Control call as well. And what they have noticed is in South Korea specifically, it appears to have they've done a good job in trying to avoid the spread of coronavirus. But that is, and I mean, they wear masks there, but that's a cultural thing that they've been doing for a long time, and it's not for the reasons that some people might be thinking. For those of you who've gone to Asia and spent some time in South Korea or Japan, you probably are familiar with seeing a lot of people walk around with masks on, but they're not walking around with masks to prevent them from getting pollution or ingesting an infectious disease. They're wearing them, and this is what they've always done culturally. So it's normal for them. They know how to put on a mask. They know how to take off a mask when they're sick. So when they feel like they're sick and they're catching a cold or whatever it is, they put a mask on to try to avoid the spread with others. That's the proper way if we're going to ever get to a point where we're promoting society. Wear a mask, and you're going to hear a lot of this probably on CNN over the next few days. But just keep in mind that one, all of our masks that we have right now need to go to our frontline workers. And we're running out of those right now anyway. So I wouldn't encourage anybody to be going around and buying masks out for personal reasons right now, even though you might be reading about the discussion of it. And it depends on the area. I don't know what they're going to decide in the US. But I can tell you for a fact, based on us doing all the research and for 18 years, that the best way to use a mask if we're going to use it publicly is to prevent someone else from spreading it. Now, I know why they're talking about potentially getting everybody to wear masks is because with this virus, like I said, a lot of people don't even know they have symptoms. So a lot of people wouldn't know to don a mask if they're sick because they don't even know they're sick. So that's why you're going to hear people thinking about that. But again, it's going to be really, it's going to be a challenge. One, it has to be after everyone else that's critical has masks themselves. And two, you could infect yourself just by putting on or taking off a mask improperly. Think about that's now another way that you're touching your face, and we're telling everybody don't touch your face because you never know what you've touched before, and now you've gone and touched your face. And I would say compare this virus to, let's say, an insect or a cockroach. Visualize that, where you don't want the potential, or you touch something, then you're touching the mask, you're putting it on your face, and then the virus is skittering into where it's now you've got an infection. So yes, stay tuned for more about masks. There is up to a 2 to 14 day incubation period for this before signs appear for the average person as well, which is, again, it's concerning because a lot of people can be walking around for several days and have it and not know they have it and be infectious and even get over it and not even know they had it at all. But the incubation period is usually 5 to 6 days, they're finding. And it's not like influenza pandemic. That's what H1N1 was. This is a coronavirus. You'll see ongoing work on lifting the restrictions and travel and the mass gathering restrictions, but those are going to come in stages. And that's what I'm sure all governments are working on behind the scenes right now, is to be able to figure out how we're going to be able to ramp things back up again and open things back up once they see the levels leveling off in certain areas. It's not going to be across the board. It's going to have to be strategically based on location and what the reality is, where you're living and where your community is. And you'll see your governments working together to help make those decisions for you. And then just the last of what I had on the call with the Centers for Disease Control, and this is something to think about as we're thinking ahead and how we're going to open up our businesses again in the new normal, and it really is going to have to be called the new normal, is that the world will never be the same. That's directly from the Centers for Disease Control. The world will never be the same. And that's not a negative thing. All of us, all industries are going to have to rethink how we do business and the safer way that we can do business in the future to be able to get us through, not just now and over the next 18 months, let's say, before everybody has a vaccine, but also that we will see more infectious disease outbreaks in the future in our lifetime. Hopefully it won't be as deadly as this one and uncontrollable. However, we will at some point. And if we get back to sort of being complacent and not thinking about it and thinking, okay, that was it, we got through that one, phew, don't have to deal with another one for a century. That's not how we should be thinking, because the way society is now And once business starts up, people are going to be flying again. People are going to be doing all of the different close contact things that, frankly, have helped spread this virus even more globally and locally as well. So everybody's going to have to really rethink how they open back up and do business in a practical way, and trying to be able to avoid close contact spread of anything that you might face in the future, whether it's another pandemic or it might just be influenza that might be serious. It could be a measles outbreak. And we saw that last year. We had a measles outbreak at a company where 90% of their critical admin staff were out for 2 weeks because they all worked in one area. That's another thing that I think businesses are really going to have to rethink, is a lot of areas have gone to this concept of open work. Open shared space concept. People sit kind of side by side with each other on a picnic table format almost, or they have satellite offices where no one has an office, but they just borrow an office when they go in. Well, think about, that's a huge way of spreading infectious disease, by promoting people sitting side beside each other, talking to each other, coughing into each other, sharing surfaces, sharing keyboards, sharing all of those things, sharing offices, sharing door handles. You're going to see a lot of places having to go back to and thinking about the old school way of how we separated people, and people actually had offices, and we didn't cram all these people into an open space. I can tell you for sure, business is going to change for those people who've gone that way over the last several years. It's going to go back to what it needs to be able to try to prevent a bunch of people sharing things and sharing germs, basically, back and forth. So those are my key mentions from the call. And I also wanted to, I want to take questions, but I want to make sure I cover off a couple of important things as well, in case they don't come up in the questions, if that's okay. I don't know how many questions we've got coming up already, Suzanne.
We have a couple questions in, but depending on how you want to do that,
Sure. I think maybe if it doesn't come up, I'll just throw this in as well, because this is something that we're all witnessing in all industries and experiencing now, and it's going to happen depending on where you are and how much you're affected, is really keeping in mind the psychological first aid. And if you can, and this is a great way of you being able to communicate to your clients as well that you're caring for them, I would say communicate to them, one, that you're working on plans now, on figuring out how you're going to be able to reopen or continue to provide your valuable services when things get back to the new normal, and you're thinking ahead of that now. Let your clients know that now, so that they know that you've got a plan and that you're not just dropping off after. Let them know that. Another thing, provide them with resources. So you might not be the expert in pandemic planning, but there are a lot of good resources out there. So maintain connection with them virtually. Say, hey, here's some great resources to access. I'll be able to send you, Stefan, I'll send you some links that you may be able to share and provide with people to have free access to that, because we all know, I'm sure some of you on the line are feeling it. Your families are feeling it. We're going to continue to feel different things while we're going through this challenging period. So one of the best ways I think that we can all be leaders is to help our clients and guide them to different free resources that they can access and their families can access and their children can access, to help keep them mentally fit as well throughout this period. And I'll share some links with you, Stefan, that you can share with the group on that. Another thing that I'll note is we're already seeing it, as Stefan mentioned at the beginning of this webinar, we're going to continue to see critical infrastructure failures. And we're seeing that now with Rogers, and there's a major outage in Ontario. I'm not going to take a guess, but I'm pretty sure that probably has something to do with the situation that we're in, and not having as many critical workers to be able to respond effectively. And you're going to continue to see more of that as well. We've seen some Zoom. Zoom's been great. Everybody's using Zoom now, but keep in mind that at some point that might fail, and we're already seeing people Zoom bombing people in Zoom meetings and stuff. And be aware of, this is prime hacker time as well, cyber attack time. And you're probably going to see some of those coming up in the news of people who've already been trying to take down our power grid and focus on other systems. And so making sure that if you have any systems in place make sure that whoever your IT guy or girl is aware of it, and just encouraging people to be extra vigilant when they get any emails or texts or anything like that, because we're seeing a really increased spread of that. So be super vigilant of that. And maybe I will open it up to questions now.
Good. So just to remind everyone on the line, if any of you want to ask their question directly, just raise your hand and we'll patch you in with Suzanne. So for now, we have a couple questions on the Q&A. So I'll start from the beginning. We'll try. So we have several. So we'll try to answer as quickly as possible.
Yep.
So the first one is from Barbara Streppel. She's asking, are there any suggestions for dealers, installers surviving the COVID-19? So, you know, the people, like installers who go to job sites or people's home, for example.
Yeah. Well, I would say that right now, what you want to do is gauge it based on what's happening in your community. And if you're feeling and you're seeing the numbers rise in your area, I would not be promoting anybody going out to perform any of those, what really are non-essential services, unless it happens to be a critical infrastructure building or office or something that you're talking about. But if it's not, you're probably going to see, and if it hasn't happened already, I mean, it's already happened in Ontario, but there'll be lists coming out of what the government deems, and even your local municipality may do this as well, what they deem critical and what they deem non-essential. So plan for potentially that. But if and when, and if it's not affecting your area and you don't have such orders in place, make sure that the two things you need to think about is the enhanced cleaning, and making sure and promoting that anytime anybody is touching something that is a hard surface, that they're washing their hands right after, or if they don't have access to it, that they're using hand sanitizer. And I would say you should be hopefully providing everybody who would be performing those roles out in the public space or dealing with any hard surfaces that they're not aware of, that they haven't cleaned personally, that you equip them with, at the very least, hand sanitizer, and with the appropriate messaging of, as soon as they have touched something, if they are able to have access to warm water and soap, to do that immediately, and of course not to touch their face after they've installed something or done something. And I'm sorry, was that an answer to the question?
Yeah, I think so. If not, I invite Barb to
Sure.
write a follow-up question here. Yeah. Speaking of essential businesses, so Alan Doyle is asking, we still have people going to work in businesses deemed essential. On top of social distancing, should all these employees be wearing masks while at work, or even when out in public, to protect their fellow workers?
Right. Well, the only way that I would say that a mask makes sense for those who do have to go out and perform roles for critical services is if you're fit tested for an N95 mask. An N95 mask is really the only mask that is going to effectively prevent you from potentially getting this virus. And N95s are also because you have fit testers that are trained fit testers to be able to know how to properly fit you with one. And so it's a challenge on that note. Otherwise, and I don't know if I mentioned earlier, but the whole mask issue is giving people a false sense of security unless they are trained on properly, just like a surgeon, on how to properly don and doff, put on and take off a mask effectively. Because otherwise, the minute that, like I had said before, I think the minute that you're putting that mask on, thinking that that's going to prevent something from getting to you, you don't know if you've touched another surface first. And then now you've touched your face, which maybe you don't normally even touch your face. But now because you think that this mask is going to save you, that you're touching your face, putting it on, and then you've gone out and about, whatever, and then you're taking it off. Well, you have to be sure that you're completely disinfecting yourself and washing that virus off that you may have caught somewhere else and touched something that has nothing to do with you having a mask on. And then you go and touch your face by taking the mask off, and then the virus skitters into your system that way. That's why, even though you're going to hear a lot more talk about masks, but be clear about the effectiveness of it. And if anything, the additional risk if you don't know how to properly put it on and take it off. And if you ask or demand your workers to do that, then you may be responsible for someone catching it anyway and saying, well, wait a minute, you gave me a mask, so I was supposed to be safe.
Mm-hmm. I have a follow-up question on this one by Alan. So he's asking, should anyone returning to Canada now be given a test automatically and be, well, automatically placed in quarantine until they can be cleared? Because, you know, after all, most of the cases right now are have been linked to travel.
Yeah, and I believe that's what's been happening. I
Yeah.
believe the federal government has ordered
Mhm.
that, and that will, at least for 14 days, I think, from when he announced it, and that'll continue. Yeah, that hasn't changed yet, and I'm sure that he won't make a change to that order until when they deem that it is
So
safe.
right now there's automatic testing.
Right.
Okay.
Well, people are told to, no, there's not automatic
Okay.
testing.
So yeah.
There's
Okay. So there's a quarantine.
automatic quarantine for 14 days. The
Okay.
testing, we don't have the capability yet to be able to
Okay.
test every single person. So that's not happening yet. Certain people who are displaying symptoms are being tested, but again, that's problematic because they're not getting a real number because there's a bunch of people who don't show signs and are not being tested
Okay.
and still may already have it. So yes, it's a good thing to be able to be making sure that people quarantine themselves or self-isolate for 14 days after they come back from anywhere. But we can't, that doesn't necessarily mean that we're safe after that. And then another thing with the testing, which people have to be aware of too, is you could be tested yesterday. Someone could have been, or whatever, someone was tested last week when they got off of a flight or wherever, and they were tested and they came back negative, that they didn't have it. That while they're walking home from the test, they could get it.
Mm-hmm.
And then so you've got a bunch of people walking around who also were tested and said they didn't have it, but then the next day or 2 weeks later, they may very well have it.
So
And
so
so
right
they
now
just
it's just assuming they have it. That's
yeah,
right now you're coming back. You assume you have it. You go
yeah,
quarantine, and that's the best practice right now.
yep.
Okay, so we have Terry Adamson here asking, is there any info regarding immunity for those that have recovered?
Right. It looks like so far the medical professionals who've been dealing with this said it looks like yes, that once you get it, you're potentially immune to it. However, there have been a couple of cases that have happened specifically in China where we've seen someone that thought that they were over it and they've gone through it, and then all of a sudden it came back in them. So, but it's not necessarily meaning that they caught it again. What they're thinking is it
Okay.
may be because it's a long one, right? For some people, it runs its course. It takes several weeks sometimes for it to be fully out of someone's system. So it could also be those cases, or that it just kind of went back dormant for a bit and then came back
Okay.
again and it wasn't really over. So you're going to see stories about that. We're not 100% sure because it's so new, but what it looks like is that once you recover, you probably won't catch it again, but they can't say for sure. And those cases that you're hearing about that seem to be that could very well just be that they still had it and then it just, came up again.
Okay. So we have Zena Gordon here asking, we were talking about the workplace and trying not to share space. And so it's less of a question than a statement here, but will it be more people working from home? Like, do you expect to see like this kind of working from home to get bigger? And at the same time, she says, it sounds like we're going to become a secluded global community, and it's going to be a psychological change for for us as a human society. Is that something you see happening?
Yeah, I wouldn't say secluded society. If anything, I think it'll be more of a socially distant society, if anything, where we're still going to be able to, and people are just going to have to think a little bit differently after this happens, where, yeah, there are going to be businesses, if it makes sense, they're already thinking about that, right? How can we do a lot of things virtually, working from home, or even, people are giving golf lessons now
Mhm.
virtually because they can't do face to face. There's all sorts of different creative things. Maybe not so much in some of our other industries, right? But you're going to see a lot more other businesses, yeah,
That's why
implementing working
they
from home.
changed it a little bit to physical distancing, right? The term, instead of social distancing, they're trying to
Right.
use
And
the physical.
yeah, here's a good term that I heard as well. The military uses the term tactical spacing,
Okay.
which in a way, that kind of clarifies a little bit more, right? So we're strategically spacing ourselves with that 6 foot distance to be able to try to avoid the spread during the height
Hmm.
of the pandemic. But also, I think that's going to be something that in society is going to be promoted more, where it makes sense to, is to have that more spacing. And you'll see lineups are going to
Hmm.
change because of it, and how everybody crams into a lineup and difference. You're going to see differences. You're going to probably see legislation change in areas where, how in concert spaces and in different spaces, that a maximum of
Hmm.
250 people that fit into that area. I can guarantee we're going to see a lot of those venues limit now the number of people, and maybe cut that in half or whatever makes sense,
And do you
to be
expect
able to have
that to,
people sit in every second seat
yeah,
until people feel comfortable and
okay.
the virus is eradicated, and we've got a vaccine. So again, a positive note is this isn't going to last forever. When the vaccine is out, the virus is going to be gone. However, we're still going to have to think about practical things that make sense to be able to still give us that distance, so that hopefully we're not passing each other's colds even as much as we do.
Yeah. So this next question actually is fits really well with what you're saying right now. So Jennifer Small's asking, when will the new normal be? Are we talking, weeks, months, 12, 18 months? Is it once we develop a vaccine?
Right.
What
I
should we
think that we're
expect?
going to start seeing a new normal within the next few months in a lot of places.
Okay.
And we'll start hearing that a lot more, people talking about this new normal. But the new normal is going to continue. But I can see that people are starting to think about it now. And once things open back up in the different areas, or get through this, for those that haven't shut anything down and maybe won't need to, hopefully, yeah, it definitely will be a new normal starting when things start ramping back up. Because
Okay.
what we're telling people is we're getting back to business, but getting back to business and back to the new normal. There's no more, okay, things are going to get back to normal. Things are going to get back to a new normal, but a safer new normal for all of us, really. Um, and we all are going to be thinking about practical ways to do that. I know a lot of people are concerned as well about what this new normal, what that means, and of course financially, and it's a tough time for everybody. But the positive side of this too is everybody's in the same boat, and the services that you may not be able to provide right now, people will understand that because everybody else is facing this too. So if your community is impacted so much so that you feel the need to have to shut things down for a bit, or you're being ordered to, your customers, your clients aren't going to take that against you, because it's the government and it's your local levels of government and others that are going to make that decision and be supporting that decision. The members of the public are all going to be already aware of that. So I wouldn't see this as something where you should be scared of losing clients because you're denying them service right now. Everybody's going to be aware and have the same challenges as
Hmm.
well.
Yeah. So I have a question here again from Zaina. So it's all put together, but we discussed a little bit about infrastructure and like we discussed previous to this call too, like the strain it puts on the healthcare, the health system right now is a risk to us. But there's also, like we were mentioning, that infrastructure, so problems that might happen, like just this internet shutdown, which is not too urgent, if you will. Like it's not too bad compared to what could happen. So Zaina's mentioning, like infrastructure that can also be water and sewer systems, right?
Yeah.
And plumbing issues, roof leaks, house electrical, heating. Uh, we were discussing a little earlier about fires, and like
Mhm.
forest, like the season, like flooding, all this type of
Yeah.
stuff. So, what should we expect in the next few months?
Well, that's a really good question too. And we're going to see that is it's not just about our healthcare system, it's about our supply chain that's going to be broken in certain areas for a while, and our critical infrastructure and the critical workers who support our critical infrastructure and keep it going. That's really the challenge right now. You're seeing images right now. I forget how many hundreds, it's like 120 police officers in New York City right now who are out with the virus. Most of them will recover, but that means for 2 weeks of isolation, that you now have, you're down, let's say, not New York, but let's say a quarter of your police force is down in self-isolation for 2 weeks at a time because one officer got it. You're going to see it in pretty much every major community. That's going to happen.
And
Um,
we saw leaders from political parties, like leaders from nation leaders, catch the virus, even after, like, some of them caught it potentially after all the precautions were in effect. And I'm kind of wondering, how does that happen? Like, because
yeah.
once it's there and you take all precautions you can, like if they end up catching it, you know what is it we're doing wrong?
Yeah, well, I think for the leaders, some of the leaders, I believe, still were shaking hands with people, and that's what leaders do. And I could tell you that's probably how some of that spread, because even if you think that you've done everything you've done, but you see a picture of them shaking hands with somebody, and then everything goes out the window because that potentially that person who seems fine and not sick at all could be a carrier, and then you've
Okay.
gotten it. The other thing that we need to be careful about and think about in our homes as well as in our workplaces is this is going to continue for several months, right? Where we're going to see different critical infrastructure areas be impacted, and they're going to be really vulnerable and really strained because also our internet, as we're seeing with the Rogers outage right now, we're going to continue to see those because we have never planned. No telecommunications provider has ever planned for this big of a usage of
Mhm.
everybody. Pretty much every single non-critical workplace is now going virtual. It is all online at the same time, and our system will at some point will not be able to support that. And we also, so while this is all going on, we also have these critical workers that are the only ones who know how to fix the systems and know how to do all of that. And if they're getting infected, because people are still going out and potentially passing along the virus to those critical workers that need to be out there on the line or doing whatever they do to support our critical work. Like I said, you take them out for a couple of weeks at a time, and then we're very, very vulnerable.
So we're
So people
protecting more
really
than
need
the,
to think,
the health system, right? We're
right,
protecting
it's
way
a
more
lot,
than that.
it's everything. It's
Okay.
everything that's deemed, and if you're curious at all, the federal government has a list of what is deemed critical infrastructure
Okay.
in Canada. It's the banks, power providers, um, you can think about it, but all and telecommunications, of course. But think about just not that they're going to be impacted forever and that people may die from coronavirus, but just that if one gets infected, they have to isolate everybody that that group worked with.
Hmm. So, more on a personal side, like for so as we have Luke Kong asking, what do you recommend we do to prepare for mandatory outdoor activities? Like grocery shopping, for example. So, just as a person yourself, like, what is it we should do to be prepared? Like, what is it how is it we should act?
How you stop when you're going grocery shopping?
Well, I mean, is there something we can do to prepare to go? Like, should we, or and actually, yes, when you're shopping.
Yeah, well, first I would say to try to stage when you go, timing wise.
Okay.
Try to go on off-peak times when people aren't going, if you have the flexibility and the availability to be able to go shopping, at 10 at night or midnight if your store's open at that time. I know some stores are also scheduling times where
Yes.
Walmart, I think, just from 8 to 9 is just for seniors and the vulnerable to go in.
Okay.
So think about that strategically, timing when you go, which will help maybe avoid a bunch of other people being out there at the same time. But Suzanne was sharing earlier when we were talking about how one of his stores in the area have implemented something really great that allows for that social distancing and then potentially the blocking of droplets. Suzanne, if you want to even share that.
Well, yeah, it's just, you have to go one by one in the store. You can have several people, but you can't be two from the same family, for example, even if you've been staying home. And all these plexiglass at the register, that was it's not something that impacted the way you interact with the cashier, but it's an extra protection that they put up out of nowhere really quickly. So, I was just discussing and asking, is that something we'll still see? Like, will they just leave that there? Does it make sense? Or, so.
And they may very well. I think that's probably something that will be one of those, the new normal. And we'll just all get used to it, right?
Mm-hmm.
And I would say that there's probably a much better case for them to keep those up there than taking them all down. And then potentially a few years later, something comes up. And then we think, why didn't we just leave them back up? Now we have to put them back up again.
Sure. So we have Terry Adamson. If there is a problem with asymptomatic people spreading the virus, why is it we're not testing as many person as we can, whether they're showing symptoms or not? Why is it we're just not testing everyone?
Well, one, we don't have the capability right now at this point to be able to test everyone. We may very well come to the point where we do. But the other problem with that is it's giving false numbers still. Because if I test you tomorrow and then you're coming home from your test, like I said earlier, and then you still could catch it from someone else who doesn't think they have it, hasn't been tested, don't know either way. And so you've got now your test results come back saying 5 days later saying, oh, no,
you don't have it.
That you've got it or you don't have it. But then 5 days in, by the time you get the test, you may very well have caught it. And so now you're running around thinking, oh, I'm safe. And yet you might have it. But your test last week said you didn't because you didn't have it last week. This is how quick this thing happens.
So I guess Zaina's question can be answered by the same way, I guess, because she's asking, would it not make sense to offer test kits to essential services persons to ensure that they do not have the COVID-19? But I guess it's the same answer, right? It's a challenge.
That's the challenge. Unless you can regularly test people,
So is that a possibility? Is that something we could do?
I would say, but they're going to have to come up with obviously the capabilities to be able to do that.
So it
doesn't exist now, but I would say that that's probably the best way for people to be able to monitor as they're going through this, whether or not they have it, is not just going by one test. It has to be a regular thing while we're in the height of this.
I understand. We have Barbara Strepo asking, are N95 respirator masks reusable?
They are not. However, you're seeing people reuse them. They're not supposed to be reusable, but you're seeing a lot of medical professionals reuse them and other critical workers reuse them because they don't have enough. Mm-hmm. And but they're only supposed to be made for one-time use. However, people are having to use them several times because there's just a lack of them.
Okay, we have Craig Stewart asking, the people who got it again, is that because the virus has mutated and they got a different version? No,
not yet. So hopefully that doesn't happen. So far, it looks like it has not mutated. So that's a positive sign. And what they're saying is, that's why they're guessing that maybe these couple of cases are more that they still had the virus and it was still going through their system. And then it kind of popped back up. Because we've seen a couple of cases of that too, right? In the U.S. where people are getting through it and think they're better, and then they get really, really sick again. So they're thinking that that's really what it is, as opposed to people catching it again.
Okay, so it did not mutate Yeah.
And no,
Okay.
no mutation yet, but we have no
We don't
idea if
know.
it may, but it's being monitored constantly by the people who would be able to recognize that as
Okay.
soon if and when it did. But so far, no.
Okay. Um, so Terry's asking, do you think somebody think getting it sooner than later, it provides a level of immunity and they're not in the critical group? Makes sense if faced with future waves and no vaccine in 12, 18 months. So I'm not sure about the sense of that question. Let me read it back. um, yeah, I don't know, Terry, if you want
So
to.
maybe, Terry, are you saying that for those, let's say, who recover quickly and they know they've gotten it and they recover and maybe they're not critical, and then we put them in those critical roles because now we know they're not going to get sick again?
Yeah, I guess that's what it means.
So there has been some talk about that in different areas, and they very well may have to do some creative juggling that way for
Okay.
people. And I could see that maybe that'll happen in certain areas where it's needed. Yeah.
Okay.
That's a good idea and suggestion. I was just talking to a colleague about that yesterday from Florida.
Okay. We have Dave Rideout asking, do you see the list of essential services shrinking if we don't see the curve start to
Yes,
flatten? Yes.
definitely.
Okay.
Yeah. And we've already seen that happen in a couple of states and provinces. And if it's needed to, you'll see those tighten up much more just to try to flatten that curve.
So we have an anonymous attendee, so I don't know who asked that question, but the question is, when there is a treatment to at least stop it from developing into pneumonia, isn't the reality we just all start our lives again and expect the fact that we'll get it, you know? But at least there's a treatment to it, and hopefully
Right.
we won't die from it until
And
we
most
get the
people,
vaccine.
right. Well, we don't know that there will be a treatment. Right now, as per specifically from the Centers for Disease Control on their call on Monday, even though you might be hearing of different potential treatments out there and different things that might work and not, there is nothing that's scientifically proven at this moment that could potentially treat this virus.
Or at least
In the future,
make
there
sure
may
you
be.
don't get pneumonia. Like, which is the big one, right? If you don't, so there's nothing out there yet that makes sure that you don't get to the more
Right.
critical stages.
Yes.
It doesn't
No,
exist yet. Okay, but
not
if
yet. But it could.
it
And
could,
that's what, of course, we have a lot of scientists and medical professionals that are working on that right now. So hopefully, yeah, we do get that in between now and the
okay.
vaccine. But so far, there isn't something that
So
exists.
if we find that, you would expect that we would keep most of the measures in place still to lower the risk of.
Yeah, and you'll see that those measures and the orders loosening up
Okay.
based on when, in a few weeks or several weeks, depending on where you are located, because some are ahead and some are still lagging behind. And you'll see those open up eventually stage wise, right? So first they'll say, okay, these kinds of facilities can reopen now.
Okay.
These people now can start going back to work who are, non-essential, but they'll open it up a bit more from essential.
Okay.
You'll see that happening in stages. And as soon as they deem, because everybody wants to get back to business as soon as possible, right? But we need to think about when it's getting back to business safely. And
Mm-hmm.
the governments are now on that to make sure that they can help us make those decisions.
So we have Zaina saying she had a couple questions about the mutation of the virus, and then you mentioned it did not mutate. She's asking, she's seen the information somewhere that the virus is mutated. There is a S mutation and an L mutation. Is that something you know about? Is that?
No, and I would say please stick with what you read on the Centers for Disease Control and your valid sources, because you're going to hear a lot of things out there, and there are just a lot of information out there. I wouldn't call it misinformation. A lot of people are posting things or talking about things that that they've heard, but I can tell you straight from the Centers for Disease Control that it has not, to their knowledge, it has not mutated.
And if it did, is it some information they would not disclose before?
Oh no, they would have
No,
to.
they would.
They would have to disclose it. And
Okay.
here's another thing: is hoping that there isn't a mutation, because what a mutation would mean is that whatever vaccine they're currently
It
working
doesn't
on
work anymore.
won't work.
Hmm.
So we're praying that it does not mutate, because if it does mutate, we have to start all over again. And the vaccine that they're working on right now for what it is now will work in 18 months. If it mutates between now and then, they're going to have to start from the moment it mutated and start back over again.
Hmm. We have Alan Doyle asking, is the new normal the presence of virus testing machines in the workplace, just like businesses have acquired portable defibrillators?
I don't see that being part of the normal in businesses. If anything, it's going to be more about the practical social distancing, promoting that where you can, and promoting the making sure that you're always aware of the potential of spread or transmission of any infectious disease. And that's where I see us being able to try to be able to control this and any other virus in the future, is from that. It's not about testing. And like I said, testing is not the most accurate anyway. And that's just an extra step that might give people a false illusion and false sense of security. The best way to be able to try to prevent it in the future is try to really think about how you're going to be able to continue your business in this new environment, maintaining the adequate distance when you can, and if and when you can't, making sure ahead of time that you're not sharing things as much as you were, spaces, equipment, and if you have to, enhancing those cleaning procedures. And I
Yeah,
think
so
that's what you're going to see a lot more of in businesses, is they're going to see people, regularly, not just overnight, how the cleaners came in overnight. You're going to see people now instituting regular, maybe, I don't know, more than once a day anyway, disinfecting or cleaning of the high touch surfaces. You're going to see a lot more of that. And you may even see recommendations from governments. The occupational health and safety authorities might even implement some things and orders like that. But it'll be more about implementing effective enhanced cleaning and that, as opposed to, I think, testing everybody all
okay,
the time for things.
which will prevent also for all sorts of disease, like distancing and cleaning should
Right.
help. Yeah. So we have Jamie asking, should we be disinfecting our cars every time we go out, because the hard surfaces in the car, and if so, is there any other way? With this, just like soap and water, or is anything else could work?
Yeah, there's so for those of you who are interested in knowing what the appropriate cleaning solutions are for your areas of business or wherever, the World Health Organization has some resources there on what their
Okay.
recommended cleaning solutions are. But for your car, but really, soap and water really is an effective way
But would you
of
say, like, every time you
disinfecting.
go to the grocery store and put your groceries in the car, or you go somewhere, like, is it, is it
I would say your door handles and wherever your high touch surfaces are, that you're going to
okay?
want to disinfect. And it may just be like the simple act of having disinfectant wipes with you. And then and then those high touch surfaces, yeah, that you're disinfecting them. And then as soon as you get out of the car, that you're washing your hands appropriately. The other thing is spatial distancing within your cars too. So
Hmm.
I would recommend this is not the time to pick up hitchhikers right now or give rides in your own enclosed vehicle to other people that you already have not been with for an extended period of time, or that you already know had the virus, or that you've been with for an extended period of time. So your family, of course, right? That you're maybe sequestered with right now. So there isn't that much of a risk if you're all sharing a car together, but you shouldn't be probably sharing your car with others in a space, because that just increases the risk as well. And in a car, that's a really close,
Hmm.
you can't maintain that 6-foot social distancing a lot of the time in a car.
Okay. We have Barbara Streppo asking. She says that she has an N95 mask that is fitted for her face. She carries it everywhere, and she uses it at the grocery store. So should she toss it, because we said it's not reusable?
Well, if she has been fit tested for it and has been trained to take it on and off properly, I wouldn't necessarily, it's not for me to say throw it away
Yeah.
or keep it, but If you know that you're donning it and doffing it appropriately, it still fits your face okay. If you have the luxury of having that N95 mask, then yeah, I would say keep it. I don't know that, just be aware still that there's a
Yeah, it's
potential.
not bulletproof. It's just,
Yeah.
yeah.
Mhm.
So we have Jennifer Small asking, so what about the longer term devastation this will cause to the economy? There won't be anything left if we keep going down this path. Um, is there anyone, has anyone balanced that with the medical professional recommendation? So the government has only so many resources to throw at us.
Yeah.
So like, I guess the question is there some people looking in this fragile balance between health and economy?
Definitely. Yeah.
Okay.
And you'll see more come out in the coming days on that as well, from the federal level, but as well as the provincial level, as they're working through this. This is, of course, everybody's concern behind the scenes, but right now, the concern to promote outwardly to the public right now is to try to stem what the worst case scenario, frankly.
Mm-hmm.
And the worst case scenario, which hopefully we won't get to that in most of our areas, because we're implementing some really good measures right now. And that's why we need to hold on to those measures for now, because the worst case scenario from this, if people don't listen, is we definitely will have overburdened hospitals and funeral homes and morgues and all of those things that we don't want society to have, and we cannot afford to get it to that level. So in the short term, and it might seem long term because their short term mind is being told 2 weeks, 2 weeks, 2 weeks.
Yes.
And why you see that keeping it ongoing is because until those numbers level off, we're thinking about all of the other indirect impacts that might happen with a worst case scenario where now you have power outages going on. The other thing that I wanted to mention, and I think Stéphane, you touched on it earlier, is that life goes on, right? And Mother Nature is not worried about where the virus is or not. So we're seeing, and we're going to see, I mean, flood season is starting soon in a lot of our areas. Forest fire season is starting soon. And those first responders are needed to be healthy and to be able to provide those critical services to save lives from those disasters that are going to be happening. So it's so much more important for us right now to be focusing on making sure that we are promoting nobody that's not essential be around anybody who is, because we need those essential people to be able to run the show when we get to these other disasters or emergencies
But
that are going to happen.
some might say, and I mean, we kind of have to agree to some point to it. Some might say that economy as a whole is essential to
Oh, sure.
all
And
of this,
that's why,
right? So
yeah. And
how is
banks
it?
and
Yeah.
they're all talking about, of course, you're seeing actions being taken by the banks. So yeah, definitely it's a critical service. So I'm telling you, there's tons of stuff behind the scenes.
Mm-hmm.
I know that they're discussing and working on to figure out how they can best do this. But the thing that we have to all be a little forgiving about, and I know, and this is all about, again, following what's going on and making sure that your mental health is in check as well, because this is the first time any of our governments have ever seen anything like this. So it's always, and I found this every time. I've been in crisis management for over 20 years. And whenever an emergency or a disaster happens, we're always looking at someone to blame or how someone could have done better. But unfortunately for this, no one could have planned for how serious this is. This is a silent threat that we've been calling it a silent threat for years. And that's really what it is. And a novel silent threat. It's brand new. No one in the world has ever seen this before. So no one in the world has a playbook on how to be able to deal with this financially or health or otherwise. We're playing it by ear now. And it's not because anybody's incompetent. It's because this virus just is so different and infectious. And we really have to be a little bit more forgiving and realize that everybody is impacted by this, every business. And we are all in this together. And the best way for us to be able to get through this and stay sane is to be able to just remember that we're all facing this. No one put this out there on purpose. No one's trying to like make decisions on whether your life is more important than your stocks or anything like that. You know, everybody's just trying to do what they can do to try to deal with this new issue that no one's ever dealt with.
Okay. We have another anonymous question here. How much of the population is anticipated to get this? Like if it keeps going at this rate?
If it keeps going at this rate, estimating about 70% of the population will get it. But remember, a lot of that percentage won't even know that they had it.
Mm-hmm.
Or will have mild symptoms where they think, oh, was it coronavirus? I don't know. And some people might not even be affected at all. So out of that 70% number. So that's not a number to say, oh my God, that's really scary. It just means that's what they're calculating is probably if it stays the way it does. And
that's considering the efforts we're doing right now, like the social distancing and the way it is right now. We're still
eventually,
at 70%.
Yeah, and that's, but over the long term.
Yeah, okay.
So that's why we're trying right now to not have 70% right now. That would then break the healthcare system. But over the next several months, but spread out so that it's not as impactful on society.
Okay. We have Bob Barron asking, a lot of companies are currently closed or closed their showrooms at least until April 13th. Do you feel the government will ask to extend this beyond that date?
I do believe so, yes.
So would you think that they're asking little by little, or do you just so it's not?
Yeah, I think it's going to be little by little. And what you're seeing is they're kind of making decisions based on, and I know the province is doing this and they announced that they're going to be deciding every 2 weeks, making a different decision. And that's probably based on because of them getting a handle on the testing results and how far the spread is in different communities and stuff. So I can imagine that will continue where you'll see every 2 weeks or so being reconsidered.
So best case scenario with what we're doing right now, it's still expected to be pretty violent at this point.
Yeah, depending on the communities. We still have a few weeks to go before we hit the peak in some of our areas.
Okay. So you would say prepare to stay closed longer than mid-April?
Yeah, depending on where you are and what the impacts are. But so far in Canada, no one has reached their peak yet.
Okay.
Even in Toronto, we haven't reached our peak yet.
Okay. Mm-hmm. So we have one question here, Dave, right out. With the projection of for a vaccine being 12 to 18 months away, considering it doesn't mutate, or is there a projection for an effective treatment before a vaccine is created? Right.
And there may be. I know that there are scientists, medical professionals that have been working on that ever since the coronavirus was first discovered. Mm-hmm. So hopefully there is, and there are people working on it and will continue to work on it. And the moment that they find something that is effective, of course, that will be shared with people, but it has to be tested and be proven to be effective before that gets.
And do you see that happening before we find a vaccine? Is that something that's likely to happen?
I don't know that anybody can tell that. Even the CDC doesn't want to be able to guess that.
So right now there's no estimate. There's no. Like because for a vaccine we know like what's likely to happen is 18 months. Like give or more.
All I know is that they are working on a couple of different things that seem to maybe be something that could be a treatment.
Okay.
But there's nothing yet. And I don't think anybody wants to promise or say that there could be until they really get on, because there's nothing to base it on yet. They're just trying to see what might work. But it could happen, and there's a lot of smart people that are working on it to see if that can happen. And as soon as if and when that happens, we'll find out about it.
So okay, so we have another question here. Our marketplace is considered essential, especially in Ontario. So in Quebec right now, it's not. Like door and window fenestration industry is non-essential for the most part, but pretty much everywhere else in Canada, it stayed open for those who wanted to. So Jamie's in Ontario. However, since the virus lives on hard surfaces for up to 24 hours, the product and packaging may have the virus from unsuspected employee, and then it can be transmitted to a customer, right?
Yeah.
Is it highly? Is this a highly unlikely scenario? Like, is
It
this
is.
us? Okay.
It's more of an unlikely scenario for sure.
Okay.
And this is based on what the Centers for Disease Control just said on the call a couple of days ago, is it's much more probable that it'd be through droplet or close human contact
So
as opposed to getting it from someone picking up.
packaging.
Right.
So okay. So on a more personal note, you get mail, you get boxes, stuff
Yeah.
like that. Can you open them, or should you disinfect them, or keep them for 24 hours away?
I would say my recommendation is to not open them for 24 hours if you can. But also it still goes back to the hand washing.
Mm-hmm.
So even if you do, let's say, open something that might have some virus on it, the best way to try to make sure that it didn't get on you or in your face and then through your system is just to wash your hands right after you handle anything like that. And you should be doing that anyway. Anytime you handle anything that's coming from external right now, as soon as you touch it, it's more about that. I would, for me personally, when I do get a package, I will wait 24 hours anyway before I touch it.
If you buy something at the grocery store that's in a box, for example,
right,
you can't really, like, will you start cleaning
yeah,
with boxes? Like,
no,
how
it's much more about
intense?
being aware that it's not as easily spread that way. It could
Okay.
potentially, and the virus has been found to live on those surfaces for a long time, but there's not much proof about how much direct transmission there is that way. Again, the best way is when you're handling anything is to be able to wipe it down whenever you're putting things away, and then wash your hands anytime you've handled any of that.
Okay. So we don't have any more open questions. I don't know if anyone wants to jump in if we didn't answer their questions, or if they want more precision on anything else different. You can raise your hand and we'll patch you in. So I'll give you like a couple seconds to let me know.
And I'll take a look at my notes again to see if there's anything that I missed.
Okay. So right now we don't have anyone asking questions. So yeah,
the
maybe.
Other thing I would recommend, that I'm recommending to other industries as well. And this one I recommended actually to a sports association yesterday. And I told them, and I think it's valid for every industry and every business. It's right now, it's not about competition. It's about collaboration in our industry. And this is a perfect example of your industry doing that. So keep on communicating with your fellow industry members to find out what kind of creative solutions they've been implementing or they're thinking about, so that you can maybe try to start implementing those if you need to. There's a lot of innovative things I'm sure that people are doing, and where they are, Toronto is facing a different thing than where, Nova Scotia is facing right now. And across Canada, things are different, but reach out to your colleagues. And everybody is realizing right now, even the major sports industries are realizing it's not about competition right now, it's about collaboration and sharing to make sure that we share whatever creative solutions that we can in the future to make sure that we do keep our business going, because our businesses need to keep going, and they will. We just have to think about how we're going to stage that and be in a new normal and use creative ways now to be able to smart and safely still do the things that we do and provide our services.
Well, I think that concludes it. So thanks a lot for the webinar. And we'll definitely call you back if anything else happens. I also want to thank again Everlast for being the sponsor for this webinar and for their support. So thanks a lot for listening. Thanks a lot for everyone who participated. So we'll put this online on our podcast feed to make sure as many people as possible can listen to it.
Thanks everyone. And I wanted to share one last thing. It's a term that we use in the emergency management industry. And it's when somebody faces, let's say, a tornado and their building has been destroyed. When they build it back, they'll build back better. And I think this is a really good opportunity that when we all get through this, not only are we going to build back to a new normal, but it's an opportunity for all of us to build back better. Think about it that way.
Thank you.
Thank you all.
Thanks.